From Washington, D.C., this is Middle East Focus.
Welcome to Middle East Focus. I'm Eliza Campbell, MEI's Associate Director for Impact and Innovation and a fellow with our cyber program, sitting in for Alistair Taylor. Today we're talking about the complex challenges facing women in the Middle East a year out from the outbreak of the Covid-19 pandemic, as well as ways to start reframing this conversation on women's rights. There's a lot to discuss, but we've got two great guests on the program to help us work through some of these challenging questions, Sahar Khamis and Negar Mortazavi. Negar Mortazavi is an Iranian-American journalist and political analyst based in Washington. She's a columnist for The Independent and the host of the Iran podcast, and is a frequent media analyst on Iran and U.S. foreign policy. Dr. Sahar Khamis is an associate professor in the Department of Communication at the University of Maryland, College Park. She's an expert on Arab and Muslim media and the former head of the Mass Communication and Information Science Department at Qatar University. Negar, Sahar, thank you for joining me today. Welcome to the program.
Thank you, Eliza. It's a pleasure to be with you.
Thanks, Eliza. It's great to be here with you both.
So thank you both for helping me to think through some of these issues. We're obviously a year out from the outbreak of the COVID-19 pandemic and some of the worst effects. We just finished up Women's Rights Month last March, and I think a lot of us are sort of thinking in the long term about some of the disproportionate effects that the pandemic has had on women in the world, and particularly in the Middle East. Some early data, some of it gathered most recently, and also some more recent trends have shown significant patterns of kind of disproportionate quality of life for women in the Middle East and beyond, with decreased outcomes and outlook for women's political, economic, social security, for education outcomes, and beyond. Data shows that women have left the workforce in large numbers or have faced special vulnerabilities as essential workers, informal workers, or care workers, while some have become particularly vulnerable due to a loss of income. In addition, national lockdowns have led to a spike in instances of domestic violence, while many important movements for women's participation in governance have stalled or been pushed back as a result of this crisis. So I want to ask both of you, and I'll start with Negar, what have we learned from this year of crisis when it comes to thinking about women's outcomes in the Middle East, and particularly how some of these economic challenges have intersected with this crisis? What are some of the biggest losses or challenges that we've seen for women as we move slowly towards what we hope is recovery?
Well, as we see, and this is a very global trend, it's not just specific to the Middle East or specific to Iran, which is a country I very much focus on and follow. But we've seen that the ramifications of COVID have been more tremendous on vulnerable populations, on women, on minorities. We see a large, as you mentioned also, a disproportionate number of women going into unemployment or, being fired, being furloughed, having to leave their jobs to be able to take care of their kids in lockdowns or supervise their schooling. And also there's the issue of domestic violence that has been very much global, but it's also been an issue in the region. It's something that I follow in Iranian media that's been reported a lot. And I think a combination of these, and then in the case of Iran, which is more of a special case in the region and one of the few countries in the world, it's also the issue of economic sanctions. Iran is under very crippling economic sanctions by the U.S. that has put a lot of pressure on the population, on ordinary Iranians, and on marginalized groups, on women as these demographics and segments of society. And that's something that's added a layer of hardship when combined with the COVID pandemic. And it's a country that's been in isolation, Iran economically, politically. And I think all of these combined together have been very challenging and difficult, specifically for women.
Definitely. Sahar, I'm curious about your thoughts. What do you see as kind of the biggest losses for women over the past year, and maybe some ways to think about where to start working forward?
Yeah, thank you. This is a very important question. Women are unfortunately the poorest of the poor. So, when you look at the economic situation in many different countries, especially if you're talking about the developing world, including many parts of the Middle East, you see that women really get hit worse with, things like, poverty, like unemployment, losing their job, not being able to find another job. They are always the hardest to hire and the easiest to fire. This is really a very sad but true reality that they have to face. They also carry the burden of being the caretakers, the ones who are taking care of the family. So, in the midst of a pandemic, a global health crisis on a massive scale like the COVID-19 pandemic, they carry the brunt and the burden of looking after sick family members, the elderly, children, the hospitalized. They're the ones who are giving all the caregiving, and the caregiving in the family is a big load that falls on the shoulders of women, in many cases alone. So all of that, in addition to putting their own lives and their own health at risk in doing all of these, different caretaking roles, and also being pretty much working as, in many cases, frontline workers, like for example, nurses in hospitals and so on, and in senior living facilities and all of these places. All of these factors combined make things a lot harder for women and make it really a very unfortunate reality for them on so many levels. And we can never divorce the social from the political, from the cultural. All of these factors are really intertwined and interconnected, and they create this kind of very gloomy and bleak reality for women. Of course, as a communication scholar, I cannot turn a blind eye also to the element of information, or in many cases, lack of access to news and information, which is very important when you're talking about a global pandemic, a health crisis on the massive scale of the COVID-19 pandemic. If you don't have access to updated, accurate, factual information on a constant, regular basis, you are at a big disadvantage. And when you look at the high levels of illiteracy, digital as well as alphabetical illiteracy in many parts of the Middle East, that means that women also are pretty much at a disadvantage in terms of having access to news and information, not to mention the infrastructural and technological constraints and limitations, which also add to the digital divide. And myself and you, Eliza, we have co-authored this piece on the COVID-19 crisis and the increased digital divide, especially among women in the Arab world. So these are realities that these women, unfortunately, are facing day in and day out. And we cannot ever talk about improving their situation when we just look at one aspect. We have to look at the holistic, comprehensive picture, and how to try to actually link and connect all of these dots together if we are serious about improving women's welfare and women's well-being.
Right. I think that's so critical what both of you said. I think probably the two biggest lessons in some ways, or takeaways from the past year, are this new framing of understanding that basically everything in the policy sense, especially on this issue, is connected, that you can't really separate out any of these threads. And also the way that I've thought of it is that this crisis has revealed that many countries, including the US, don't have safety nets built in. Instead, in a lot of cases, we have women instead of safety nets who basically play that role. So thinking going forward about, the next crisis or the next emerging health emergency, how we better prepare for that and how we better invest in the women who often play the role of emergency workers, I think will be really critical. So I do want to kind of take a step back and think kind of more broadly. Obviously we have a new U.S. administration. There are some, burgeoning changes in U.S. foreign policy that are just sort of getting started, particularly in the Middle East. I think in some ways this is a time for a reset in thinking about how we even approach this issue of women's rights and women's health in the Middle East. And as you both know, in some cases, I think this topic has been shunted to the side or has been thought of as maybe like an extra, a luxury topic that you get as soon as you're done thinking about the more serious geopolitical topics. And I'm personally of the opinion that this is really an incorrect framing. And I wonder if either of you have sort of thoughts about what are some of these common misframings of how the larger conversation about women's rights in the Middle East has been had internationally, and maybe how it can be the case that we start integrating in some of these considerations for women's lives and for women's rights into the geopolitical conversation more specifically. And Sahar, I think I'll go ahead and direct that to you first, and then Negar, I'd love to hear your thoughts after that.
I think a very important golden rule we have to always pay attention to is listen to women. Women's voices many times are not heard. They're talked over, people talk over them, men talk over them, governments, administrations talk over them, but they don't listen to them. If we are really serious about improving the situation of women in many different parts of the world, especially if you're talking about developing countries, developing parts of the world like the Middle East, you cannot look at that from a top-down perspective of, oh, let's go there and try to help the women. I think this kind of skewed understanding or approach, like, quote unquote, save the Muslim woman syndrome, that has really prevailed for a long time and has influenced the policy takers and policy makers, including in successive US administrations and Western governments. Like, oh, what can we do in order to improve women in the Arab world or the Muslim world? And oftentimes these women say, you know what, we don't need saving, we need understanding, we need to be understood, we need to be seen, we need to be heard, we need to be truly respected. Our values, traditions, lifestyle, what we hold dear and near to our heart, all of that needs to be more visible, more clear, more respected, and more taken into consideration. So I think the listening and understanding approach is key to really trying to approach this issue from a much more equitable, fair, just, realistic, and productive approach. But the top-down form of, ethnocentrism or Eurocentrism or privileging Western perspectives and Western culture, Western values, Western feminism as the one-size-fits-all that women all over the world have to, live up to or just fit into is never a productive approach. So that is a key, in my opinion, to really improving all of these issues together.
Definitely, I agree, to kind of put women back at the center of the discussion. Negar, I wonder if you have any consideration on this issue, particularly as it relates to Iranian women who, as you noted, are sometimes treated in this special case or as a special case.
I second what Sahar was saying as far as the overall situation in the region. But the case of Iran is also very special because there's this political animosity with the U.S. and the U.S. government, various governments. It's a very bipartisan issue. But more so the Republicans, the ones who have more hawkish views and policies on Iran, try to champion human rights, women's rights, all of these, supposedly organic internal movements in their political discourse that's against the Islamic Republic. But in reality, when you look at the policies that are coming out of Washington, U.S. foreign policy towards the region, and in this specific case, I'm talking about the Trump administration, it goes against almost everything that's to the benefit of those very women, the movement, the women's rights movement inside the country, and everything that those women are striving from. There's this great piece in the New York Times. We can talk about it in more detail later, but I just want to mention, written by Azadeh Moaveni and Susan Tahmasbi, both gender experts, about the almost disappearance of Iranian middle-class working women under the pressure of U.S. economic sanctions. So the very demographic and the very part of society that U.S. officials, namely in this piece, they actually named former Secretary Pompeo, they speak in their names of these Iranian women, is the class that's disappearing as a result of U.S. policy, of Washington policy towards the Islamic Republic. So it's not always the statements they put out or the, feel-good press releases, or in the case of the Trump administration, a high number of tweets that were put out in support of these movements in Iran, the women's rights, free speech, freedom of press, and human rights, but it's actual policies that are hurting the citizens on the ground, and in this case, very much women.
Certainly. And I think this is something kind of in a broader sense that we should make sure that we keep track of and start thinking about how to reframe this. And how to think more holistically and more broadly about this debate, because as you both noted, I think very eloquently, often this issue has kind of been reframed or has been taken on in, pursuit of certain policy agendas, or again, as Sahar mentioned, has been very oversimplified. So I think that understanding will be really critical to thinking about where we go from here, kind of post-COVID. So the next thing I kind of want to move to is thinking about women's health outcomes and women's well-being over the course of this pandemic, and kind of looking forward, thinking about what next steps look like and how to start to repair some of the damage that has been done. So it's been reported, early data has shown that COVID cases do disproportionately tend to impact women in certain parts of the Middle East, particularly parts where women are disproportionately representing certain segments of essential workers, including nurses. And I'm wondering, Sahar, if I can go to you, what have you seen as some of the particular disproportionate impacts of the pandemic on women in the Middle East from a kind of holistic health perspective, not just physical health, but mental health as well. And what do you think makes women kind of more vulnerable in many ways to the disease and its long and short-term effects as well?
Absolutely. That's a very important question. I did my PhD, that was a number of years ago, at the University of Manchester in the UK. It was about Egyptian rural women and the impact of the public awareness campaigns about family planning, literacy, and health awareness on these women's lives and how they were actually perceiving and interpreting these messages. So I was really stunned by the amount of lack of sufficient infrastructure in many of these villages, many of these communities. There's no even basic, clear system of health care. There's no resources. There's no good health center or doctors, or even sometimes the basic infrastructure, like a good sanitary system or sanitation, or, all of that stuff is missing. Clean drinking water, for God's sake, is still a major problem, believe it or not, in many parts of the developing world, including many parts of the Arab world and the Middle East. That causes kidney failure. It causes all sorts of health hazards. So you look at this very grim and very bleak picture, and then you add on top of that a global health crisis like a major pandemic, COVID-19, and you can really see how things can impact the poorest of the poor, as we said before, women in this case, being marginalized, being poor, lacking resources, lacking health care, lacking necessary services, facilities, resources. All of that puts them, of course, at great risk. And of course, on top of that, as mentioned before, there's also the factor of being the caregivers and the caretakers in the family, and also playing roles as nurses and teachers in many cases as well. All of that adds to their own health risks, in addition to the shortage in the infrastructure and the resources. And again, we have to go back again to the point of also lack of access to correct, factual, important health information, which makes things even worse for them. Because if you can't get accurate information, you are not sure about what's going on, right? The picture is very fuzzy, it is not clear, it is quite distorted in your mind. You're not sure about, is this really truly a pandemic? Is it really serious? There are still people who are sharing misinformation, rumors, and lies about the nature of this disease and how dangerous and how serious it is. There are those, of course, who get all of this misinformation from different sources and they have no way to check it. With the high illiteracy rates and the high digital illiteracy rates as well in this part of the world, that puts women's lives at risk. Many of them are not getting the right, correct health information, and some of them are getting the wrong misinformation or disinformation, which also leads to other problems as well. Not to mention, of course, the shortage in, of course, the availability of medications and health services and vaccines, which are really a very rare resource in many parts of the developing world, including the Middle East.
Certainly. Yeah, it's definitely been proven to be the case that good public infrastructure is very much a feminist issue in some ways. Negar, I want to go back to the article you mentioned and kind of thinking about, you've written extensively about the impact of the Trump administration's maximum pressure campaign and the US sanctions and other sanctions on Iran, and particularly how Iran's healthcare workers and its nurses, who are overwhelmingly women, have in many cases kind of borne the brunt of some of the worst impacts of this pandemic. Can you talk a little bit more about this phenomenon and kind of what it says about women's health outcomes in Iran and in the Middle East more broadly, particularly in the context of international policymaking?
Sure. Let me just actually make it clear that there is obviously a lot of gender discrimination in Iran, both in when it comes to the society, the culture. It's a very traditional and old heritage, patriarchal, and also when it comes to law and policy. There's obviously no disagreement on that when it comes to Washington, but we're obviously discussing how U.S. policies can help or further hurt what's already a very unequal situation when it comes to women in Iran. And in this piece that you mentioned, that this extensive investigative report I did for Foreign Policy magazine about Iranian healthcare workers, specifically nurses that are predominantly female in Iran, and they have a lot of internal problems that is due to domestic policies of Iran. They have some salary issues, they have work hours, are overworked, they're underpaid, they don't have enough benefits, and all of those is the domestic portion of this problem. And then when you add this U.S. policy and mainly this issue of broad economic sanctions. In the case of COVID, in this report that I did, we found out that personal protective equipment, PPEs, that are specifically needed for healthcare workers, frontline workers, when it came to COVID, there was a shortage of that in Iran. At least at the beginning, there was a very serious shortage, and it negatively impacted healthcare workers, specifically nurses that were at the front lines of dealing with COVID patients in Iran, which was the epicenter of the virus. Iran was one of the first countries to be infected, basically the virus being introduced after China, and it has been for the past years the epicenter of the virus in the region. And this was one of the very direct ramifications of these sanctions imposed by the Trump administration, and right now with the Biden administration, so far they've also continued. But it's something that we could pinpoint as far as the impact of this policy on at least a specific group of women, which is frontline health workers in the COVID era. We found out that Iranian nurses are basically dying or being infected by COVID in a very disproportionate number when you compare it to other countries like even China or in hotspots in Europe like Italy. It started with the story of a 25-year-old nurse in a northern province of Gilan. Her name was Narges Khanalizadeh, who was reported at least to be the first nurse to die of COVID last year. And then the story continues with dozens of other nurses and healthcare workers who have been suffering due to bad policies of their own state, obviously, and then also this added layer of U.S. economic sanctions that prevented the country from accessing enough PPEs, and it's in some case even COVID tests at the very beginning. And now they're also dealing with the challenge of paying for vaccines, which is another important issue I can talk about later.
Yeah, definitely. No, that's so critical and something that I don't think is very broadly understood or talked about here in Washington. And I wonder, actually, just to pose it to both of you, as Negar mentioned, the topic of vaccines. Are there ways to start thinking about, in the context of the Middle East more broadly and in Iran specifically as well, how to make sure that vaccine rollouts, vaccination campaigns are equitable, that they make sure to, increase accessibility for women and for different types of vulnerable populations across the region? Do either of you have thoughts about how to do that in a smart way, or what you're noticing on this issue about how we should think about it going forward?
I just think globally we need to be more equitable, more ethical in terms of looking at issues like resource distribution and sharing, especially if you're talking about, a life-saving product like a vaccine. We're not talking here about a luxury item or some kind of, something which is optional, luxurious. We're talking about a life-saving vaccine. So I would have liked to see more developed countries like the US, Western countries, to really not use the policy of hoarding vaccines, but rather thinking of ways to make them reach those who are most needing of these vaccines in less fortunate or lucky parts of the world that don't have the resources, that don't have the monetary resources or facilities or the same health system and the same access to vaccines. Unfortunately, so far, I don't think I'm seeing an equitable or fair or just distribution of the vaccines. I'm seeing the hoarding on part of big, superpower like the US. I'm not seeing that reaching, other parts of the world. I would think it's very important to have more international coordination and collaboration and cooperation on the international front to work out with, for example, organizations like the World Health Organization and others, different strategies and resources to make sure that these vaccines can be channeled in the right way and can get really in the arms of people who need them the most, including women who are the most vulnerable, as we said before, the most marginalized and the poorest of the poor in many different parts of the world, including developing countries in the Middle East.
Yeah, that's so critical. Negar, I wonder if you want to speak to that at all, kind of on the vaccination question.
Sure. I second Sahar on the issue of hoarding vaccines, and sort of what we see from the US, Canada, certain Western countries, this attitude of everyone for themselves and, try to use as much power, economic power, political power to just watch out for your own population. Whereas this virus or this pandemic is something that knows no borders, it knows no politics, it doesn't recognize friends or foes, it just goes beyond borders, it goes through airplanes, it goes across oceans. And it's something that I think the world should think about to tackle together, and not just everyone for themselves, be it within a community. Right here in Washington, D.C., in our city, we've seen not very equitable distribution of vaccines when it comes to certain zip codes, certain income levels, even certain marginalized groups. And then when it comes to countries as a whole and the world as one global community. And then in the case of Iran, again, as one of the few countries being isolated from the most powerful countries in the world, the US, the West, and also under these very broad economic sanctions, there's also that layer added that makes it even more specific. So Iranians are dealing, and Iranian women and also Iranians as general, as a population, they're dealing with certain bad policies of their own government. There was this famous order from the supreme leader that banned UK and US made vaccines, a few different types of these vaccines that are made in the US and UK, and he just straight up banned the country from using them. That there's that kind of bad domestic policies when it comes to the vaccine and fighting this pandemic. There's also policies from Washington that directly impact the country. Iran has had very difficult challenges of trying to pay for the COVAX because of U.S. sanctions, because they have not been able to access their funds and foreign banks and to transfer them to the World Health Organization. There's been a lot of delay in payments for those vaccines. There's also been this lack of access to the global market when it comes to any kind of trade, import and export with Iran, and the vaccine has not been exempted from that. And then also the issue of how the government is rolling out the vaccination plan. So far, it doesn't seem to be a very clear plan, a very clear timeline. And we see a lot of criticism coming from civil society and various activist groups inside the country. There is some prioritization given to health workers, frontline workers, different vulnerable populations. But as far as a mass vaccination plan or a timeline, it's not much we're seeing very clearly from the government. And it's also definitely become more difficult and challenging because of policies that are imposed on the country from Washington.
Yeah, definitely. And I think that feeds really well into what I wanted to bring up next, because as you say, Negar, and Sahar, we should not kid ourselves. Economic well-being you cannot separate it from people's physical well-being, particularly in the course of a pandemic. And so in some ways, it's important to kind of connect these two conversations. So Negar, I'd love to go back to you and kind of hear a little bit more about the challenges to economic security and well-being for women in Iran. Going back to that article that you mentioned about kind of this disappearing class of Iranian women, particularly as a result of the harsh sanctions and, decreased opportunities for employment and for economic security. Can you speak a little bit more to how this has impacted women in Iran, and maybe how to start thinking about some more inclusive and more thoughtful policies going forward?
Sure. So Iranian women we have to remember at every point, they're going against two very powerful currents. There's this economic issue, the issue of isolation from the world, the issue of foreign pressure from the US on the government, which gets very much translated or directed onto the population. And then also laws of patriarchy, tradition, and just their own long-term strive for more equity, equality, and democracy and modernization within the country. And in this specific piece that we were talking about in New York Times, they focus on Iranian middle-class working women because they're seen as very, very crucial agents of change, agents of modernization, of liberalization, of reform that have been pushing back against these traits of patriarchy, of women, the model of the woman being a mother or a caretaker for children, that being their primary responsibility. That's something that's being pushed by the state very much onto the population. And they've been going against that, trying to defy that by being independent, economically independent, having full-time jobs, and just pushing for more access and a higher place within the society. And what these sanctions or the economic situation has done is that it's made it very difficult or almost impossible for these women to continue that role, to continue that long time reform. They have either become unemployed, they've lost their jobs, they have to work multiple jobs. It's just become very, very difficult for a middle class woman in Iran to be economically independent, considering the inflation, considering all the various traditional and policies and laws that they have to go against to. And it's almost a disappearing class. That's something that this piece is arguing. And again, it goes to it shows the contradiction coming from Washington, that on one side, from the statements, from the press releases, from the look of it, it seems like women's rights and modernization and reform and equality is something that the United States government wants, but when it comes to policy and the actual changes on the ground, we see it not really helping improve the situation of women, and in this case, even making it worse and harming the very demographic that they're claiming to help.
Yeah, definitely. I think it's important to start thinking about how these two things intersect as we go forward. And in that spirit, Sahar, I wonder, so you spoke obviously to this digital divide in the Middle East currently among women, and in particular from an educational and work perspective, how that digital divide is impacting not only, women's educational outcomes as more schools have moved online, but also kind of long-term employment outcomes and even health outcomes, as information that's typically available online or communication channels or, safety resources that are available via the internet are less accessible to women who, lack stable internet access. I wonder how you might think of this issue of economic security among women and how it intersects with this digital divide, in particular, thinking about economic outcomes as a result of employment that's accessible via the internet.
I think they're all interconnected and interrelated, very closely interconnected and interrelated. You can never separate one or divorce one from the other. If you look at the bigger picture, as we said before, the infrastructure, the poor infrastructure in many parts of the developing world, including the Middle East, when you look at rural and remote communities in particular, you look at the poor educational system, the lack of access to resources and information, the lack of the proper and well-trained and really efficient educational and training systems in many of these countries. All of that means that you have a great disadvantage for marginalized groups, including women. And these experiences of marginalization become even worse if you're looking at low income women, women in isolated communities, in rural areas, in remote areas, Bedouin communities, and the list can go on and on. So I just actually published a piece about the perceptions of international educators about online teaching and online learning and education. And it was very clear they had big concerns about certain groups and certain categories, including people with disabilities or students who have special needs, and specifically also concerns about the gender gap in education, and specifically the digital gender gap as well in education, and how it impacts women disproportionately in very negative and very harmful ways. Because when you look at women in many parts of the developing world, they're denied access to education. Therefore, when you have school closures because of the pandemic, what does that mean? It means you have many girls who are not going to go back to school. That's the sad reality. Many of them are not enrolled in school anymore. They're not going to school anymore, and many of them are not even returning back to school when life goes back to normal. That means many of them might just end up being, married at a young age and just starting to have children at a young age. Their hopes of completing their education, getting employment, formal employment, getting an income of their own, all of that is becoming less and less possible, and less likely under these circumstances. When you add to all of that also the very high rates of illiteracy in many parts of the Middle East, and not to mention also on top of that the digital illiteracy, lack of digital literacy. I always talk about the digital divide becoming even worse when you talk about the gendered digital divide. All of that means you are exacerbating and you are really magnifying all of these problems and all of these hurdles and challenges which have been disadvantaging women. So you have to look at the whole picture holistically, and also to try to tackle it holistically as well.
Yeah, definitely. And I think kind of building off of that, one way to start thinking about women's political participation and involvement in a more holistic and more realistic manner when it comes to the Middle East is to start kind of taking the broader look and looking at some of the local organizing, some of the local movements, on the ground in various countries that are going on right now, that have been going on for some time, and that, sometimes here in Washington, we don't necessarily pay attention as much to or have as much information about. So, Negar, I want to go to you to talk about Iran had what some referred to, for example, as its own kind of Me Too movement this past year in mid-2020, as many women spoke out about experiencing sexual assault and rape and named some prominent figures, and it kind of sparked this larger conversation in the country among women's rights activists, among democracy activists, about the future of organizing in Iran and around kind of women's position in society. I wonder what you think some of those takeaways are from a broader rights perspective in terms of thinking about women's voice and women's involvement in politics in Iran, and maybe what are some things to think about as we go forward from here.
Sure. As you mentioned, Iran had its Me Too moment, and I like to call it a moment, as many women's rights activists are, and not just a movement, because this is something that has been ongoing, and it didn't start last year, but there was an uptick last year with the help of social media, specifically Twitter and hashtag activism, and it got a lot of media attention. But it's been something that's been going on actually in some more traditional and marginalized communities, where women, for example, in Baluchistan, spoke out against rape, and they defied a very, very traditional setting when it came to the culture of that specific area and also policies of the state. But this Me Too moment last year, it was incredible. It started with a group of Iranian female journalists who spoke about, sexual abuses or harassment from male colleagues or male interviewees, people who they've had to interact with in their work setting. And then it was expanded to the art community. Women started speaking out against very prominent male artists, cultural figures. And in some case, I would say one of the most disturbing instances was a male women's rights activist and researcher who was working with very marginalized communities on very, very controversial issues, for example, female genital mutilation and very sensitive topics like that when it came to a traditional society. And it turned out that some of these men in these settings were actually put themselves in very as predators in a setting to be able to take advantage of these marginalized and vulnerable subjects, these women that they've been working with. So it's been an incredible and ongoing movement since that moment. Women are still talking about it. Media is still covering it. There's been a lot of education happening around it from these public conversations, this public debate. What constitutes rape? What is the definition of consent? What is sexual harassment? What is considered okay? What is not okay? Why you shouldn't be blaming the victim? Why working men and women together is not necessarily the woman's fault? And all of these gray areas, very intricate discussions that have been very taboo. It's not something that you, as a woman, you learn on a daily basis in the Iranian education system at school or even college. And these have been some of the discussions that, thanks to social media, have been shared in a national setting. And bringing the issue of COVID back into that, it's just made it more complicated because obviously, any kind of person-to-person presence has been limited with COVID. A lot of projects have been put on hold. People are working from home. Media don't have as much access to their subjects, to people to interview. But it's just something that, because it was born on social media and it's continuing on social media, I still see the discussions ongoing to this day, and it's been a very transformative chapter, basically, when it comes to women's issues in Iran in general, and also a level of advocacy and education in the country as a whole.
Yeah, and so definitely something for us here in Washington to make more of an effort to follow more closely, and maybe to try to pay attention a little bit more to some of these local organizing efforts and their long-term implications. Sahar, going to you, I wonder if you can comment more broadly on kind of the status of women's online communications, particularly in the midst of some of these democracy movements and some of these ongoing uprisings. What have we learned in the past year about how organizing for women's rights in the Middle East can be accomplished or can be, hindered in some ways or held back by this new reliance upon online communications and ICTs?
I would say to really understand, this whole situation and really answer this question in a holistic and comprehensive sense, we have to situate this within the larger framework of cyber activism and the role of social media and new media in the midst of the Arab Spring uprisings. I would say before, during, and after the Arab Spring uprisings. And to just put it in a nutshell briefly, I would say there was this moment of techno euphoria when the powers of social media were amplified and magnified, and scholars, writers, intellectuals, including myself, were like, yes, social media and new media are going to be the big key, right, to paving the way for change and transformation and reform in the Arab world. And we're going to see a big smooth transition to democracy, and Facebook and Twitter and YouTube have been doing a great job helping all of that. Well, this is just part of the story, but the bigger story or the bigger picture is you really need to have a lot of infrastructural changes, and you need to have changes in the society itself. You need to get rid of corruption and the deep state and nepotism and authoritarianism, and to really have an active civil society and great NGOs, and to allow opposition movements to really thrive and to work without the burden or the threat or the risk of being called foreign conspirators, or just conspiring with foreign countries and putting them behind bars and sending them to jail. All of these hurdles are very real, unfortunately, in the Middle East, and they do hinder, the ability of activists and opposition movements and journalists and academics to do the job that they need to do in order to enhance and improve the quality of life and civil societies in their own countries and in their own societies. Women are not separate. They are, as I always say, women are half of society, and they give birth to the second half. So you can never turn a blind eye to the importance and the significance of women's role in society. But unfortunately, a lot of societies, they just brush off women's issues and they just sweep them under the rug, and they just say, oh, okay, let's have, a smooth transition to democracy and build our society. And then maybe we can take a look at women's issues. I always say this approach is doomed to failure. And it really is a big shame that women put their own lives at risk. They organize and they actually participate in protest movements, in demonstrations. They can get arrested, they can get harassed, they can get killed. And then at the end of the day, when there is some kind of initial success or improvement in the situation, they're told, thank you so much, ladies. It's time for you to go back to the kitchen or go to the hairdresser. That is definitely not acceptable, but that has been, unfortunately, the pattern that has been pretty much underway. So when you have the derailment of democratization in the Arab world, with the unique exception of Tunisia, all the other Arab Spring countries really witnessed a lot of unfortunate results, as we have seen and heard, of course, after the Arab Spring. And unfortunately, that also led to worsening the status and situation of women in many of these countries, because, let's face it, women are part and parcel of society. And if you have a derailment or a backlash in democratization and reform, what does that mean? It means it's also going to impact women's movements and their ability to organize and mobilize and carry out their work on the ground and online. That is the sad reality. Having said all of that, let me say there's some light at the end of the tunnel. Indeed, as you said, we have seen also what we can describe as the second wave of Arab protests or Arab uprisings in the region. We have seen mobilization in Algeria, in Sudan, in Lebanon, and we have seen an active and visible role for women in the midst of these new waves, and they're playing very visible roles. I would say really, really, kudos to them, really thumbs up to them. On the ground and online, they are very visible, they're very active, they put their own lives at risk. Oftentimes they get arrested, they get harassed, some of them die, they lose their lives. It's very, very commendable and very admirable what they're doing. We just need to give them all the support we can, as I said before, by being better listeners and better allies and supporters.
Yeah, I think that covers it really well. And kind of turning as we finish up, towards the future, it's right now it's spring here in Washington. It's the vaccine spring. Hopefully we're moving towards the end and the light at the end of the tunnel, as you say, when it comes to this pandemic. And so, Negar, I wonder, as we think about U.S. foreign policy in the future and some openings towards some, new cooperation or some new, reductions in tension, How do current trends on U.S. foreign policy look in terms of Iran to you currently, particularly when it comes to outcomes for vulnerable people, including women? And how might the new Biden administration address some of these questions around the disproportionate impact of U.S. sanctions on health questions, on the health of women?
Well, I think as we're speaking right now, these days or this week, there have been some new developments. I'm hoping that diplomacy between Tehran and Washington will be renewed. They're having indirect talks right now. They're not meeting face to face, but it seems like both sides want to return to diplomacy and the nuclear deal, the JCPOA, which I see as just the beginning of further talks and negotiations and diplomatic engagement between Tehran and Washington, and essentially a lifting of sanctions, of these broad economic sanctions that we discussed, some of the effects on the population in Iran, specifically women. I think it could open the door for a better economic situation, and how we discussed that would help women come out of this poverty and unemployment and various vulnerabilities that they have in the country, and essentially open the doors also, because it's not just the situation of the economy inside the country, it's also the isolation of the Iranian society from the West, from the outside world to some extent, that has been marginalizing these people even more. So hoping that with renewed diplomacy and with better relations and more agreements, there will be more collaboration between women, women's movements, women's activists, and women in various sectors across the region. So Iranians with the Arab world, with some of their other neighbors, and then also beyond the region to try to connect to other movements in the West, even here in the US, and help foster or develop this long-term strive that Iranian women have been, the push for more rights and equality and democracy. But I think the first step is the lifting or easing of these economic sanctions that have been devastating for the country, and to get out of this situation of this pandemic, as Sahar was saying, with vaccination. Like, we see the light at the end of the tunnel, although it's far away for certain countries, for more developing countries or poorer countries, but it seems like we do see this light at the end of the tunnel. And then coming out of this pandemic and this economic devastation, I'm hoping that the Iranian society in general, and it's a very young society, I want to also add that the majority of the population, 70%, is under 40 years. So it's the Iranian youth and then also Iranian women who are both, I see, as agents of change, and coming out of this economic situation would help them foster more reforms in the country and strive for more equality and democracy, essentially.
I want to just jump in quickly here and just second what Negar said about, the role of youth and women. I would also say in the Arab world, this is pretty much the reality that we have. In the case of the Arab world, more than 70% of the population under the age of 30 or 35. And you look at an area like the Gulf region and you have almost 90% of the population under the age of 35. So we're really looking at a very vibrant, very active, very youthful population, which is becoming more and more educated, more technologically savvy, more capable of using new media technologies. I think they are the hope and they are the future. And when we look at this region, as much as we have all of these challenges, all of these multi-layered challenges we talked about, we also should acknowledge this definitely hope and this renewal and this, new energy which is coming with this new generation that really gives us hope and gives us light at the end of the tunnel, that there could be some good steps in the right direction. But in order for that to happen, we also need international collaboration, coordination, and really coordination on a very big international scale. That is also a very important piece of the puzzle.
Yeah, I think that's so critical, and thank you for that. So thanks so much to both of you for an excellent discussion. There's certainly a lot to learn and a lot of work to do, but I definitely feel like I understand things a little better and the future looks a little bit brighter. We'll leave things there for today, but Sahar, Negar, again, thank you for joining the podcast. Thank you to our audience for listening in and to our production team for their work on today's program, and see you next time.
This has been a presentation of the Middle East Institute. To support MEI's programs and podcasts, please donate at www.mei.edu. Thank you for your support.